you, Mr. Chairman. I appreciate it very much, and I thank the panel for their testimony today. Mr. Carson, as we discussed earlier, how the $100 billion, at least $100 billion tax on health insurance will drive premiums higher. And I know that you have analyzed the tax cumulative impact in depth. Can you explain what it means when you say that the Affordable Care Act constructed this tax to be non-deductible, and why is it a non-standard treatment of taxes?
Well, you know, in very simple terms, the tax is not considered an expense in the, you know, in an income statement, so it won't be charged against the company until, you know, after their taxes are taken out of their income or what their profitability is. So, in effect, that means that not only do they have to fund the tax, but they also need to fund an additional amount to reflect the taxes that they will have to pay on that. So, you know, as Dr. Holtz-Eakin said earlier, you know, you have to collect $1.50 in premium in order to pay the dollar of the insurer fees.
Thank you. Again, Mr. Holtz-Eakin and Mr. Carlson, the tax on health insurance is one of many factors that will cause the premiums to rise. I think we've established that. There's a real threat that small employers will be forced to terminate employee coverage and send their workers to the exchange subsidized coverage. What will the repercussions be if this happens? And if both of you can give me an answer, I'd appreciate it.
Well, I mean, certainly if you do the arithmetic for any employer whose employees are under 3% of the federal poverty line, it is a no-brainer to stop offering insurance, send individuals to the exchanges. You can give them a raise. They can use the after-tax raise and the subsidies to buy better insurance than you could offer them. You can pay a penalty on top of that and still make more money. And so there are overwhelming economic incentives for a vast number of employees to end up at the exchanges. The implications of that, I think, are pretty straightforward. Number one, the federal budget cost is going to be radically higher than has been estimated to date. Number two, if in fact we see the premiums increase at the same time, those subsidies will increase per person. So again, we get a second hit on the budget cost. This will change the provider networks that many of these individuals will be accessing, and so we'll get disruptions in their care. And the labor market turmoil, I think, will be substantial. And we're beginning to see that with the large number of employers who are moving people to part-time status instead of full-time in order to accommodate the mandate. It's just one of the many potential labor market manifestations of the big implications of this law.
Thank you. Mr. Carlson.
Yes, and I will just add, you know, the $8 billion that starts in 2014 is a fixed number. So if the pool of fully insured premiums that amount is charged on goes down, in effect, the rate will go up. So if you look at our study, we have a high estimate and a low estimate. And the high estimate for the percentage is based on the assumption that employers, especially in the small group market, will drop their coverage and put their employees out into, you know, buying an exchange or other alternatives. So, you know, and we relied upon industry studies, which in fact said that, you know, is a possibility going forward. So, you know, the more employers that drop their coverage from the fully insured market, the more likely it is that rate, premium rate increase will continue to go up further.
Thank you. Mr. Chairman, I yield back. Appreciate it.